Yep, we're live now. Hi, everyone. Good evening. We're going to wait a few seconds or about a minute for people to stream in.
How long have you guys been doing Facebook Lives for?
So about over 2 years, we've been having
Wow,
these weekend
cool.
workshops. Yeah, ever since COVID, actually,
Yeah,
since I think March or May of 2020,
yeah,
and so we used to do these workshops on our own platform. We built it ground up,
yeah.
uh, and in the last few months, we've been doing the Facebook lives. We figured
Cool.
it's just kind of easier, and
Yeah,
yeah.
yeah. It's kind of cool to have an opportunity to address anyone who may be interested in like right now, but also I think some of these, this is recorded, I assume, right?
Yes, that's right.
Yeah. So like anyone has an opportunity to go back and see something like this, which is kind of cool.
Correct.
Yeah.
For those who are joining in, we're going to start in about a minute. So stay tuned. If you guys can see us and hear us, feel free to let us know in the comments. I can see people joining in. I've also shared it across a bunch of groups. So let us know in the comments section if you can see us and hear us fine. All right. I think we have a bunch of people that have tuned in, and more will keep coming in. So, good evening, everyone. Good morning to our friends from the states. Welcome to yet another Blue Circle workshop every Sunday evening, 5 p.m. India time. We have these workshops on various topics related to various types of diabetes, and today we're going to be talking about the metabolic and mental health impact of type 1 diabetes and the implications of low carbohydrate diets. So, with us today is Dr. Andrew Koutnik, who is a PhD. And I'm going to request him and then Nandita to quickly please introduce themselves, and then we can jump straight into the session. Andrew, over to you.
Awesome. Well, it's a pleasure to be here. I appreciate Blue Circle Foundation for Diabetes having an opportunity for me to engage with you guys. I think the foundation is incredible. I think it really does a lot to help those with people living with my disease and even beyond to the greater diabetes community. So it's an honor to be here and to speak to everyone live. So my background, I have a PhD in biomedical sciences. Also have a degree in exercise physiology. Exercise physiology was looking at a lot of that was looking at not only lifestyle implications for overall health, but a lot of that work was in mental health. So looking at the implications of things such as lifestyle mimetics or things that we can do in our life, or even pharmaceutical interventions to improve mental health, or individuals who have prior brain insults. So did some work in individuals with cardiovascular disease and also stroke. But then went on to study actually lifestyle interventions. We looked at interventions such as low carb diets, also things that may mimic or model some aspects of low carb diets like exogenous ketones or other pharmaceutical interventions like metformin on various aspects of not only just normal everyday health to understand how these might affect metabolism, but also on the greater implications of disease, which is a obviously near and dear topic to in my life because I have type 1 diabetes. I'm also a visiting research scientist at Institute for Human and Machine Cognition. I've been with them for 3 years, and I'll kind of pause there and say that I guess paramount to me being here is obviously mentioned earlier that I have type 1 diabetes. I'm very, very passionate about this topic from a research perspective, but also personally to do what we can to improve people improve the lives of those patients who have type 1 diabetes. So I'll pause there and on to you, Nandita.
Okay. Hello, everyone. I'm Nandita Thomas. I've been a type 1 diabetic for 24 years now. I have a 7-year-old son, and I am the head of performance marketing in a digital marketing agency. I work from home, and Nupur is a really dear friend of mine. We recently met up, and but we've been friends for almost 4 5 years. So whenever she says, let's do something, I'm always happy to help, because I know a lot of y'all may be going through some mental issues, or just the fact of living with type 1 diabetes or any form of diabetes in a society like India, or even being a woman, or like, there are challenges that happen on a daily basis. And I feel, if there is a platform where we can address it, I should voice my opinion, which is why I'm always happy to be here. I've done a few sessions with Nupur, and it's always a pleasure to be here, and looking forward to a good and fruitful discussion with Dr. Andrew and Nupur.
Thank you guys. Really, really appreciate it. So all three of us, like the two of them also mentioned, live with type 1 diabetes and do low carb. And we look forward to all of your questions. Keep them coming. Keep your questions, comments, experiences coming in the comment box. I can see that you guys can see us, and a couple of comments have come in. So I think we'll jump straight in and start with the first question then.
Yeah, Andrew, in your introduction, you had said that you've done a lot of your work or your research has been with the mental and physical challenges that type ones face. Can you explain a little bit more, like, what are these challenges that a type one or anyone with diabetes faces on a daily basis?
Yeah, I think this is a very underappreciated aspect of the overall health of someone with type 1 diabetes. Those individuals with type 1 diabetes are at increased risk for mental health issues. And I guess it doesn't come as a surprise, because usually this actually it occurs post-diagnosis. So it isn't uh, inherent that someone necessarily is pre-diagnosed and they're at greater risk, although we know that happens with individuals with type 2 diabetes or with prior brain health issues. Getting type 2 diabetes or having blood sugar swings, we know, can affect their overall outcomes. But individuals with type 1 diabetes are at much higher risk for things like depression, anxiety, even bipolar disorder. The studies are any one study may show a different degree of risk, but we know that the incidence can be as high as almost half of patients can have symptoms of mental health disorders. And we know that in some cases, there's data that the risk for an actual full-fledged diagnosis is somewhere between 2 to 6-fold higher, depending on what study you're looking at and where you're pulling the data from. I mean, some studies have looked at hazard ratios, which are, for those who are unfamiliar with this from a scientific terminology, let's say one hazard ratio means that you have no greater fold risk. So it's one fold, which means 1 times whatever number is the same number, except 0. But let's say you have 2 hazard ratio, it implies you have 2-fold higher risk. And there have been some studies, and like, for example, of countries like Taiwan, for those individuals who have type 1 diabetes, that the hazard ratios for almost all mental health disorders, ADHD, anxiety, depression, bipolar, schizophrenia, are north of 8-fold higher. So this is a very, very common issue, and really a lot of this data has looked at what the association would be to cause altered brain health. And a lot of this has originally not focused on mental health. It's purely how do we improve metabolic health biomarkers. But I think what is often lacking in that discussion is when people talk about type 1 diabetes or being on the roller coaster of blood sugar control, because it's an every meal, everyday challenge for individuals. Those up and down numbers, if it didn't have health consequences, which we know it does, we know that better blood sugar control within the normal range does have pretty obvious and well-established outcomes in not only health, but disease progression and pathology. But we know it directly is associated with mental health. And anyone living with type 1 diabetes, including myself, with greater fluctuations, higher or lower beyond normal ranges of blood sugar directly affects your mental health. And you don't have to look much further than looking at the symptoms of hyperglycemia, the symptoms of hypoglycemia, to see that a vast majority of these are actually altered mental statuses, fatigue, anxiety, feeling lethargic. I mean, it directly impacts the mental health. And we know that inherently as people living with type 1 diabetes, because as blood sugars go up and down, those affect how you feel. I mean, very, very directly affects the individual experience of the person with type 1 diabetes as blood sugar does fluctuate. And, I follow a low carbohydrate diet in full transparency to everyone listening here, but I do so because it has done remarkable things for my ability to control my own blood sugar. And the data on that seems to be pretty consistent thus far across about 20 trials or 20 publications in the space of very low carbohydrate diets, 50 or less grams per day, usually fibers, carbohydrates. But there's actually been a ton of studies in what some people would term low carb, which is less than 45 gram or 45% of your total calorie intake coming from carbohydrates. But I'll show like, for example, this is a CGM. I don't know if it's going to be able to come through, if it's clear or not. But in essence, it's usually when you look at people who have really, really good control, it's not a flat line still. It's still going through what someone calls sinusoidal waves, or these up and down pulsatile waves every day, even when you do everything you can to minimize the overall variance in blood sugar up and down. So I think that that's really, really important to appreciate and or consider in your journey for mental health, is what can be done to improve that. Precedence in type 1 diabetes, with the growing incidence of metabolic health going up even outside of the realm of type 1 diabetes, but certainly within type 1 diabetes also. So all to say, I could go in much more detail, but I'll pause there if that helped answer that question.
Yeah, I think it's such a. I don't think. I've been going to doctors for 24 years. I don't think anybody has ever. Every time you go to a doctor, they just say, okay, show me your blood sugar readings. But nobody has ever asked me a question. Okay, how are you feeling today, or
Yeah.
how have you been feeling? I
Yeah.
don't think there's any scope or space for checking the mental health of a type 1. I don't think this has happened. I don't know, the listeners who are watching, maybe you can share your experiences, but personally I have never had a doctor ask me, how are you, are you feeling okay, like what's your mental state. I don't think, even though there's so much of awareness today on depression and other mental conditions. I mean, at least people are talking about it, but I don't think, um, at least for me personally, I don't know, Nupur, if you've had any experience with doctors checking in on your mental health as well, because there's so much to battle on the physical part. I don't think there's any space for this, but I think, yeah, I get what you're saying, Andrew, and I completely agree that, like my husband sometimes calls me a drama queen, because he knows that, if I am going cranky, he'd be like, look, your blood sugars are all over the place. They are
Yeah.
on a roller coaster. That's why you're behaving like this.
Yeah.
But it actually, you feel bad, like, you want to control your emotion, that the rational part of your brain is saying, no, no, I shouldn't be behaving like this.
Yeah.
But it takes some time to come to that realization that, oh my god, because of these blood sugars that are going up and down, I'm behaving in a way that I know is not acceptable, or that I know is wrong. But I don't think doctors or any medical professionals shed any light on this aspect. And I think Blue Circle does a wonderful job by talking about mental health now and again. Over to you,
Yeah.
Nupur.
Yeah, thanks, Nandita. I know, I agree. I think the whole, like, health systems. At least, I mean, we can talk about India. We get only a few minutes with our doctors, right? And there's literally been no occasion to really sit down and talk about mental health, or how you're feeling, or any of those things. So I think we're off to a really exciting start, and I can see a comment that just came in from Punita, and Punita is a mom to a T1D, and she says, "My daughter has changed. Her behavior has changed a lot since her diagnosis, and I wish to speak to someone about it, but I can't understand who. I'm not sure if it's related to her blood sugars, and please suggest someone in Delhi for counseling. So Punita, I know you know, but our NGO runs a helpline. It's called the Buddy Project Helpline. You'll find it on the Blue Circle Diabetes app. And all the volunteers on the helpline are people with lived experience of various types of diabetes. So, feel free to schedule a call. Feel free to also consult a mental health professional. So these are things that you can look at. And now I'm going to ask Andrew. We've been talking about mental health, and I want to bring the discussion, connecting mental health and low carb.
Yeah.
Andrew, I'd like to understand your experience. How you transition to low carb, and second part of the question, about how not to feel deprived when doing
Yeah.
low carb. A lot of people feel that it's a, a sort of deprivation. So
Yeah.
how do you get that out of your head?
Yeah, and I appreciate that question. And I, to the mom's point, and to what we were talking about before, I think it's really important to destigmatize these issues. That's why I want to speak about them. I don't think anyone's gone through their entire life without feeling some symptoms of depression, anxiety at some point. It is just much more prevalent with not only the burden of the disease itself, not only on the patient, but also the family members as well. But you also have we know the blood sugar can affect multiple aspects of your brain and how it I won't say feels, that's not a scientific term, but it can translate to how you feel. So I think it's important discussion all around. There are some specific terms related to things like diabetes distress, which is this cumulative term of the overall disease burden, the blood sugar fluctuations, the overwhelming amount of information and processing that goes on a daily basis to try to be, your own metabolism. You are your own, thermostat for your metabolism every single day. So I think that's important to acknowledge, and props to all parents who are helping their kids navigate this disease the best they can, because it can be easy to just say, let me just do whatever the minimum, but kids really need the best opportunity to thrive. And go-getter parents or parents who are out there really trying to help their kids, I cannot be overstated how important that is. I am a father also of two kids, and I could only imagine. They don't have type 1 diabetes, but they're at like what I think 21-fold times the risk for getting it. So that's on my mind. But to transition to your question about low carb and what got me into that space and this idea of deprivation and other aspects that come along with it. So my personal journey to getting onto low carb actually was because when I first got diagnosed, 16 going on 17, this is almost like 16 years now. I didn't do it originally. I was doing everything as instructed, which is, carbohydrate counting. You have a basal amount of insulin, and then you basal bolus strategies. So you bolus for the carbohydrate intake or the amount of carbohydrates in the diet. And I did the best I could, but I was also, I found very, very quickly that consistency helped a lot. So, if I were to eat certain types of food, they would reliably just not work well on my blood sugar. And then I would have to combat feeling, fatigued or irritable, et cetera, when I go high, or I would often run the risk of running low. And there was virtually no chance of sitting in normal blood sugar ranges all day, or what is normal, by doing that approach. Not just what, I thought, that's what I was finding for myself. So it's all about the individual experience, right? So whatever works for the person is what they should do. Well, along that journey, I had, I was big into fitness and nutrition at the time, and still am. Actually, it kind of framed my whole life existence into where I am now. And type 1 diabetes, getting that is what made me become, or go all in and become a lifetime career in science. But when there had been some discussion in the low carb community, even a long time ago, because Atkins, if people are familiar with that, at least in the United States, when there's a big book that came out, really started to bring public awareness to lower carb diets. Now, there's controversy over the Atkins approach and how it was implemented, or the messaging around that. But nonetheless, it brought attention to it. And there have been some people who had speculated on some potential benefits related to, performance in the athletic sense. So I was always very big into exercise and, wanting to improve my own, performance, bigger, stronger, faster. That was at that time in my life, I was heavily focused on that. So I thought, okay, let me give this a shot. And so so going on this approach, I had contacted someone who had actually done a professional athlete, actually, who I was familiar with, who did this approach. Just reached out to him and said, I'm considering this. What do you think? And they ended up working with me to kind of not only transition my insulin, because that's a part of this approach, because the lowering carbohydrates, then what's the most predominant macronutrient in the diet? Now you're talking fat and protein based foods. And so those foods don't respond the same way in your body and how it affects blood sugar as glucose does. So there are other insulin options out there that I was informed of, like things like regular insulin for protein-based foods. And I started utilizing those and lowering my carbohydrates and just eating a kind of protein focus, but still having fibrous vegetables as a part of the diet and having enough fat as required for energy-based needs. And I went to my doctor 3 months later. First off, I felt great. So I was performing better in the gym. I was probably also low, even though I was eating sufficient calories. I was probably low on the amount of fat I was consuming because my strength instantly shot through the roof. And I looked better. And I was like, oh, this is great. At the time, I was much younger. So how I look, and it still matters, but how I looked, I was like, that was a huge deal to me. And also self-esteem. So I found that I was very rarely going above 120, or very rarely experiencing the symptoms of hypoglycemia. But more importantly, I wasn't getting hypoglycemia because I didn't have a CGM at the time. They weren't readily available. And so most of what was cueing me in that my blood sugar was good was how I felt. So I felt great almost all the time. And it was only upon reflection, a month or two in, I'm like, I feel great. Obviously my gym performance went up from a weightlifting perspective, which was very important to me, but I felt better. And then I go to my doctor 3 months post, and I had my blood work done. And my doctor says, what are you doing? And I was like, that's a weird, that's a weird statement by him to start the conversation off. He said, this is the best blood sugars I've ever seen in my office. And immediately, that kind of changed my whole life from that point forward. One, it reinforced that I was doing something right. And it also reinforced that the objective outcomes of this disease, things like HbA1c, were in the non-diabetic range. And so that immediately taught me, like, I'm onto something here. Not only do I feel better, I'm performing better, but now my numbers say that I'm doing something exceptional, and that really made me feel empowered. And from that point forward, I was full-fledged on that approach. Now, when we talk about things like deprivation or this feeling of not having what, say, someone else has, it was a little different for me, because for me, I was in athletics. So I was so focused on that it was kind of like, what foods do I need to perform better? Like, just give me what that is, and I want to do that. And so I was a lot maybe easier than the typical person going on this approach. But I'll tell you, as time has gone on and as I've communicated with more and more people, it's not my same focus. I'd love to perform better. I'd love to be the biggest, strongest possible. But I am now 33. I have 2 kids. I'm not going to be a powerlifting champion. I want to be as functional, as healthy, cognitively intact as possible. I want to feel great. I want to be there for my family, and I want to be there as long as possible for my family. So from a food perspective, for most people, when you go into a grocery store, at least in the United States, and I don't know how common this is across all countries. I've been to some European countries, some South American countries, Canada and beyond, but I don't know what it's like in India. But I know when you go in the grocery store in the United States, the vast majority of the foods in there are carbohydrate-rich foods. In fact, the center of the grocery store is almost exclusively carbohydrate-based foods, processed carbohydrate-based foods, and it makes up most people's diet. And that's also what was recommended, and still kind of recommended for individual intake for someone's food. So when someone switches from that, because of the inherent precedence of what's normal, people may feel like, okay, I'm not normal anymore by doing this. But I want to touch on a couple of things here. So first, it's all relative, right? So if those foods weren't in the grocery store every day, if higher carbohydrate diets wasn't necessarily the precedent set in society for what you should be doing, then people wouldn't feel deprived. So I want to kind of immediately put that out there and say it's all relative because of the set precedence that's out there. Now, does the precedents mean it should dictate how the future goes? No, I don't believe so. But if you were to have felt deprived or have felt like, okay, my son, or like the parent who just spoke, I believe it was about their daughter, let's say that they wanted to participate in activities of other kids and their lifestyle. Well, you can make a lot of these foods because of the the global popularity of the ketogenic diet. If you actually, one way of indexing that is looking at something called Google Trends. So you can look on Google and you can assess and search a term. And if you search a ketogenic diet over the longevity of how long Google Trends has been collecting data as an index of how interested people are in this, it's the number one diet across related queries and topics over the longevity of Google Trends. Now, popularity obviously goes up and down with time, but either way, that interest has translated to tons of options for people to not only buy things at the grocery store nowadays that are keto or low carb friendly, but also to make them on your own. And, for me, I don't feel deprived at all, but this is, I think, an important topic to address in general. When someone goes on gets diagnosed with type 1 diabetes, food is now the most important factor that will affect your blood sugar. We know carbohydrates is the most potent factor on postprandial or post-food hyperglycemia or blood sugar levels. We know insulin, the primary drug to survive with type 1 diabetes, is the most potent hypoglycemic agent. So these two factors are now the most powerful factors in your disease regulation. So you have no choice but to consider them in your disease management. So once you get diagnosed with type 1 diabetes, food is now a required aspect of how you understand and live your life in order to manage your disease. It is not fair. People, when they get diagnosed, think, well, this isn't fair. I want to eat what everyone else eats, etc. But by getting the disease, while fair or unfair, understanding your nutrition, understanding how it works with your medication is now required. It is required for your health. Ignoring it will only lead to suffering, unnecessary. So a level of ownership is very important with how food is ingrained or inherently involved in the disease management process. Because carbohydrates are the most potent aspect of the diet, and because insulin is the most potent hypoglycemic medication, carbohydrates for glucose, if you can lower both of those, there's a possibility to potentially reduce the inherent variability in blood sugars over time. And we see that in the data. The income or the data is limited right now, but there's a lot of over 20 published studies at this point showing remarkable outcomes in glycemic control, a lot of which are actually achieving completely normal values in glucose control. And that's what we hope when you're a type 1 diabetic and you, or anyone who gets diagnosed with disease, you hope you walk into the doctor office and that doctor says, hey, we figured this out. We know that you have this disease, but we have a solution for you to be like your neighbor who has, they don't have this disease, but you have an option now. Okay. But you can do it differently, but hey, there's an option for you. And I think that that's important to at least make aware to individuals in general. But that's a long-winded answer to say that there are plenty of options nowadays to help overcome the deprivation that some people may feel. And that's largely due to overall general public interest, not just in diabetes, but everyone has been more interested in this. And that's opened up resources, information, and education for people to make a birthday cake or make muffins, make a donut, make bread. You can make all those foods and make them low carb. And generally, they're lower in calories and made up of healthier options. So in general, it might not be a bad idea to do, even if you weren't specifically trying to do it for diabetes. Just lowering your caloric intake or choosing healthier options is most people would argue that's a good idea. So, but.
Okay. So we've got some questions here, Andrew. I think a lot of people are interested in what you're talking about. So Pratik says, "Hey Andrew, it's been some time. I'm doing research with respect to food as well. I have got concluded that there is no superfood. Each food has some amount of antioxidants. The only thing I believe in food is the right amount, like protein 1.2 grams to 2 grams, depending on your training and your experience. You can experience fat of up to 0.7 grams per kg of your body weight, and the rest is all carbs. I only feel the diet is the best when you can sustain it for a long period of time. So he's asking, what probably are the essential elements of a low carb diet. What should you, how much amount of proteins, how much amount of carbohydrates, because everybody is
Mhm.
just doing some kind of way guesswork
Yep.
right now when people are starting off.
Yeah. So there are some general guidelines put out there for what people believe is optimal uh, for a well formulated low carb diet, because you can definitely do this wrong. You can, if you're reducing carbohydrates from the diet, how are you getting other macronutrients, phytonutrients, etc.? So formulating it with energy dense, healthier food options is a generally advisable idea. To address the idea of how much of each food, what he's talking about from that grams to kg or grams to pounds conversion for protein, that's based on, some of those numbers are based on just general recommendations for bare minimums to meet requirements in the daily diet. But there's some evidence that going higher on the protein level can help muscle health, maintain healthy muscle mass and function, especially for those who are resistance exercise or even those not, especially in the aging population. But what formulates a macronutrient composition for a low carbohydrate diet? I think that it's important again, no set specific guidelines say you should do insert the blank for type 1 diabetes with low carbohydrate diet. Unfortunately, there hasn't been as much discussion as there should be on these topics, especially with the amount of people who are doing these. But generally what people are doing is, if they choose to go on this approach, they are, one, try to make sure that they get sufficient, fibrous carbohydrates in the diet. So let's say that these are things like spinach, broccoli, not just those, but you can do other options as well. There's plenty of these, but higher fiber content, not starchy, not sugary carbohydrates, but higher fiber content, usually green vegetables. Getting sufficient amount of those for phytonutrients is generally recommended. So you hit your fiber content, you're hitting phytonutrient content, and then having sufficient protein. So making sure that you're hitting enough protein within a diet. So that 0.7 grams per pound, or I think it's 1 to 1.2 grams per kg as a general recommendation. But I don't know if I'm nailing those numbers exactly off the top of my head, but I do know that the amount that is sometimes recommended for optimizing muscle mass can actually be north of like 1 gram per pound, or 2.2 grams per kilogram. And there really isn't much benefit to go further beyond that level, but within that range is generally recommended for minimums to optimizing muscle mass health. So within that range. Then fat is usually recommended to hit your energy need requirements. So let's say that someone was trying to be an athlete and perform some long duration exercise. Well, they're probably going to need a lot more fat, and ideally in the form of healthy, nutrients dense fats, like some things like certain nut sources, or certain even plant-based fat sources. I mean, those are all good nutrient dense options, usually with more minerals, less processed. Let me just put it this way: less processed options are generally better options for food. They usually have more micronutrients in them, and other healthy food options. But let's say that someone's trying to lose weight. The first opportunity would be to pull the lever on the amount of fat consumed in the diet, and keep the other aspects of those amount of phytonutrients and fiber to hit minimums, and then hitting the protein content to optimize what you want for your muscle mass. And then using fat as a lever. Okay, I need more energy intake. I'm going to eat more fat, or I want to lose weight. Let me pull that back. I'm going to have less of that. So that's kind of your lever, as some people like to describe it. And that's kind of the simplistic way to do it without getting into micro details on numbers that really people don't care about. At the end of the day, that's how people tend to approach that. I don't know if that helped answer the question fully. But I do agree. I want to mention, I do agree with his point on sustainability. So any approach you do is critical to do it in such a way that allows it to be done long term. Because if you do this for a week and then you stop for the rest of your life, that's not going to help you very much. It's going to maybe help you for a week if you're lucky, but really the sustainability of it is critical. So if you don't do it, it won't help you. So finding ways to do it long term is really, really important. And that's where, things like if you switch to an approach like this, one way to do it is to look at what you're already doing, you already enjoy, and what of that would fit into this approach, and use that as your foundation, and then build new aspects into it. So you're not going from this lifestyle to a massive lifestyle shift. You're making as minimal of a shift as possible that you already know you enjoy, and working off that foundation seems to be very, very helpful for many people.
Got it. I'm going to do a quick summary of, I'm going to try and do a quick summary of what we've just spoken in Hindi, so that, our viewers who speak Hindi can also understand. So, आज हम लोग बात कर रहे हैं लो कार्ब के बारे में, और हम लोग बात कर रहे हैं मेंटल हेल्थ के बारे में. मेंटल हेल्थ जिस किसी को डायबिटीज़ है, बहुत इम्पॉर्टेंट टॉपिक है, और ये काफ़ी बार इग्नोर हो जाता है. हम लोग इतने बिजी हो जाते हैं अपना डायबिटीज़ मैनेज करने में कि हम डिप्रेशन, एंजाइटी, जो मन में डर है, ये सब चीज़ों को हम एड्रेस नहीं कर पाते हैं. तो ये सब आपका जो मेंटल हेल्थ है वो रिलेटेड है आपके फिजिकल हेल्थ के साथ. तो आपका जो ब्लड शुगर्स का जो रोलर कोस्टर है, हाई लो हाई, वो अगर थोड़ा सा स्टेबलाइज हो जाए तो डेफिनेटली मेंटल हेल्थ पे भी पॉजिटिव इम्पैक्ट पड़ता है. अभी हम बात कर रहे हैं लो कार्ब की. लो कार्ब में कितने ग्राम्स क्या खाना चाहिए, तो ऐसा कुछ फिक्स नहीं है. आपको अपने बॉडी के हिसाब से चेक करके कीप टेस्टिंग, ब्लड शुगर्स आप अपने टेस्ट करते रहें, और वहाँ से आप फाइन ट्यून कर सकते हैं. I want to circle back to the mental health aspect with two comments. One comment is from Prashant, who lives with. So, Prashant is a cyclist and he lives with type 2 diabetes. And he says that he struggles explaining to other people, about the different sort of aspects of mental health and diabetes. And a few days ago, he was feeling lethargic and he didn't really want to do anything other than sleep for a while, but people around him think that he's acting irrational and he's being silly, and so how should he explain this to others? And there's another question after that. There's a parent of a T1D, Balram. He says, how is stress related to blood sugar levels? So he's asking for his child, and during the exam time.
Yeah. So the first question is on type 2 diabetes and helping explain to other people. So those who don't have type 1 or type 2 diabetes might have not ever experienced the magnitude and duration of high blood sugars or hypoglycemia that may accompany living with diabetes. So how do you help explain that to someone else? Well, the best way to do it is to think, at least just right off the top of my head that comes to mind, is when someone eats a ton of food, when someone, for hyperglycemia, this is how I explain it. So if you feel high and you feel fatigued, lethargic, if that person has ever eaten a ton of very, very dense nutrient, high carbohydrate based food, just overindulged, ate a ton of food, and they feel, I feel tired, I feel lethargic, I feel like I want to sleep, I have no energy, it's hard keeping myself cognitively intact, I want to doze off or get tired. That's one way to explain to people that's what hyperglycemia feels like all the time, and to explain to them, hey, you might feel a third or a fourth of the magnitude of that. But just think, when you eat all that food and you feel so tired afterwards and exhausted and you have low energy, that's maybe you getting to 160, 180 blood sugar levels. It comes right back down. Now imagine you not only went to 160, 180, but some people are going to double that value and staying there. So imagine having twice the impact on how you feel and sustaining that impact. So that's one way to describe to individuals, because I'm sure most people have felt that overwhelming fatigue that has come from food. So it's a way of connecting food to how they feel. And then another way to describe low blood sugar levels that I like to that I often use for individuals is in two ways. One that I think resonates with more people for sure is, if someone has a normal eating pattern, let's say they ate 3 to 5 meals per day, and let's say one day they something happened in their life. They weren't able to eat all day. And they get to the end of the day and they start to feel shaky. Okay. They start to feel fatigued. They feel irritable, like anyone around them, they just want to, chew their head off. They're very, very angry and irritable. That's the same feeling that some people get right at the start of hypoglycemia. So people in the general population can start to feel that way anywhere between 70 and 80 milligrams per deciliter. People with type 1 diabetes or type 2 diabetes who are on insulin lower medications can sometimes get anywhere as low as 40 to 70. So the magnitude of that is dose dependent as well. So the lower you go, the more you feel up to a certain point, the more adverse effects you feel. And so that irritability, that shaking, that fatigue, the lack of mental clarity and irritability, that's hypoglycemic symptoms. And type 1 and type 2 specifically who are on insulin lowering medications, those individuals can feel much more pronounced aspects. So it's almost just describe, hey, in your life, you have felt maybe a little bit of this here and a little bit of this when you're up here. Hey, guess what? I live there. People with my disease, they live in these areas all the time. In fact, much more extreme fluctuations up and down and sustained in those areas. In fact, the data says right now that those people in type 1 and type 2 diabetes live the vast majority of their life outside of 80 and 120 milligrams per deciliter. So the vast majority of people's lives isn't even in normal range. So that's important to appreciate. But if people don't get the hypoglycemia analogy, another way to describe it is when you felt extremely stressed, anxious, let's say you have to give public speaking when you're younger, or maybe even now it still is very stressful to you, that stress response is very similar to the biological stress response people actually have with hypoglycemia. So hopefully that helps address how do you explain that to the individuals. And that also connects the mental health aspect, because that's obviously affecting how you feel on a regular basis. But to the point of the second question about type 1 diabetes, can you restate that question? It was from a parent from type 1, correct?
That's right. He wants to know how does stress impact blood sugars and how do I manage during my child's exams?
Yeah. Okay. So I know in the United States, they allow for some provisions to be implemented in schools. It's actually mandated by law that if your child has something like type 1 diabetes or another disability or disease, or whatever you want to call it, because in the United States, it is classified as a disease disability. You're allowed to have special provisions to ensure you're within normal blood sugar range before you take an exam, because we know that cognition is changed if you're in hyperglycemia or hyperglycemia, just in those ranges. But I know personally living with type 1 diabetes, the fluctuation, even if I'm swinging from one value to another, that can definitely affect how I feel. So there are provisions in schools that can be done for parents that they can put in, at least in the United States, and hopefully that's the same in other countries, to allow their child to have to wait until they're in an ideal range before they take an exam. Otherwise, it kind of leads them to an unfair disadvantage when taking their examination. But how does stress affect blood sugar? Well, it depends on the situation. So if you're let's say everything is completely controlled, there's not food or exercise or other factors involved, and you go from feeling fine to being extremely stressed. Well, typically that would be associated with a stress response, which can cause blood sugars to potentially elevate if the stress is high enough. So it can cause hyperglycemia, or the biological terminology of this is glycogenolysis. You're basically taking glucose that's stored in your liver and releasing it into the bloodstream, because your body sees that as kind of this fight or flight. So, hey, we need nutrients. Let's release them into the bloodstream because something stressful is happening. And you probably need that to run, get away from something, or use those nutrients for something else. So that's a typical stress response. But alternatively, let's say you get but there's a whole fluctuation across the spectrum of how people may respond to this. It is not always consistent. Some forms, typically stress is going to elevate blood sugar, full stop. But there are some exceptions where forms of stress can do the opposite and cause heart rates to elevate sustainably over a period of time. And then that can change how the insulin's absorbed. So it comes in faster. And then you could have an unexpected decrease in blood sugar because of these factors. So generally speaking, it goes higher, but there are exceptions to that rule if you consider individual nuanced situations with all the factors that come in, especially with type 1 diabetes, such as what you eat, when do you exercise, what time of day is it, how much insulin did you take, and when did you take it? There's a lot of things that go into that. So.
Got it. Maybe I'll take a second and quickly, say this in Hindi as well. So, प्रशांत का क्वेश्चन था कि मुझे टाइप 2 डायबिटीज़ है और जो मेंटल हेल्थ एस्पेक्ट है वो ज़्यादा लोग समझते नहीं हैं कि कितना स्ट्रेसफुल हो जाता है डायबिटीज़, तो कैसे मैनेज किया जाए। और एंड्रू का आंसर ये था कि आप लोगों को एक्सप्लेन कर सकते हो कि जैसे अगर आपने बहुत हैवी मील खाया, अगर आपने बहुत कुछ हैवी खाना खाया है, आपको कैसा फीलिंग आता है? बिल्कुल खाने के बाद जैसे नींद, थकावट होती है, नींद आती है, नींद आता है, तो वैसे फीलिंग मल्टीप्लाइड बाय 10 या मल्टीप्लाइड बाय 15, ऐसे फीलिंग जब हम हाइपर में होते हैं, जब शुगर्स हाई होती है तो हमें ऐसे होता है। और जब हाइपो होता है, बिलो 70 जब शुगर जाती है, समझ लो कि आपने पूरे दिन खाना नहीं खाया है और सडनली आपको रात को एकदम शेकी फीलिंग या आपको थोड़ा-सा मतलब इरिटेशन महसूस होता है, तो वो सारी फीलिंग्स आप एक्सप्लेन कर सकते हो लोगों को ये एग्ज़ाम्पल्स देके, जो नॉन डायबिटिक्स हैं। एग्जाम और स्ट्रेस को लेकर के एंड्रू ने ये कहा कि स्ट्रेस डेफिनेटली इम्पैक्ट कर सकता है शुगर्स को, लेकिन अगर आपके बाकी जो वेरिएबल्स है सारे, जैसे कि फूड हो गया, आपका एक्सरसाइज हो गया, अगर ये सारे आर इन चेक, तो देन यू कैन मैनेज योर शुगर्स बेटर। ओवर टू यू, नंदिता।
Okay, great. Thanks, Andrew. I mean, we have a lot of questions coming in, but
Okay.
I will just move on to this question about, is low carb safe for young kids, for growing kids, older people, pregnant women,
Yeah.
and is it also safe for vegetarians?
So, all right. So, is it safe? Well, I will say this. No institutional body that I know of right now is prepared to make a strong stance on any of that. Those are unique populations outside of what people would term normal, healthy adult, which is, usually the ones people feel more comfortable, saying, give it a try. But when you talk about kids, when you talk about pregnant women, talk about, people are very afraid to touch this and give any stance on this. I will say this. There are thousands of adults doing this approach. There are thousands of kids doing this approach safely. And what I mean by safe, what is defined as safe? They're having no adverse outcomes. They're having much improved mean blood glucose and standard deviation. They have an improved subjective quality of life. In fact, one of the largest studies on this is an observational study in a group of individuals who specifically are community organized around helping individuals guide their life on type 1 diabetes. And that's a group called Type 1 Grip. And this is a study done by Harvard and Duke. And what they showed is that at least when they surveyed the individuals from the community who were willing to participate in the study, they got doctor confirmed data, so their health records. And these individuals also they reported exceptional blood sugar control. The mean blood glucose was right above 103 milligrams per deciliter. Standard deviation, I believe, was right around 30 milligrams per deciliter. These are remarkable. These are unheard of with any other therapeutic approach in type 1 diabetes. But half of that cohort was kids. Slightly north of 40% of that cohort was kids. So north of 100 were showing that they were able to do this. And the amount of severe adverse side effects was dramatically lower than what is seen in the average type 1 diabetes community. So that's important to illustrate from a pregnancy perspective. So is it safe? At least there are examples in the literature and out in the general community of people doing this safely. Now, that is for kids. Okay, talking about kids and adults who are doing this. There are some reasons and then I'll go to each one and then I'll talk about what is the hesitations that some people will have with this approach. Pregnancy. There's only been one study in pregnancy in the very low carbohydrate arm, and it was a case report. And so there is no real data on this in very low carbohydrate communities in type 1 diabetes. I mean, one case report doesn't count. as far as hard evidence for what it or isn't happening. I do know there are community groups, though, or at least a community group that has successfully done this in a large number of individuals who are pregnant, but there is no data looking at any aspect of disease outcomes. So it'd be impossible to say, hey, an evidence-based discussion on this says insert the blank. But what is important to appreciate, and why this is such an important topic to get more research on, get more funding for education, and provide more advocacy in these communities, is we know that elevated blood sugar in pregnancy has a tremendous amount of adverse effects on fetuses and future outcomes in kids that last their lifetime. So we know that this is outside of type 1 diabetes. This is with women who have type 1 diabetes. This is also for gestational diabetes. So we know that there's no argument against that. I would be shocked if anyone's willing to actually make a legitimate argument that glucose doesn't affect outcomes in children. It does. Insulin load also does as well. That's why gestational diabetes is of concern. And what do they recommend in gestational diabetes? Lower the carbohydrates in the diet. Like, this is the first thing they do, right? So there isn't strong data in type 1 diabetes. I mean, there's virtually none. And so that's where we are with that. But we know that not controlling blood sugar levels has clear negative outcomes. That is not controversial. That's just what the data says. For older adults, they would be treated just like any other person, unless they have some other disease, where the disease itself may influence how they respond to this. Let's say the individual is hypertensive, because hypertension is very common in older age. Are they on blood pressure lowering medications, or are they on a diuretic, or one of these other medications that may affect, like, say, orthostatic hypertension? Well, we know when you go on an approach like this, essentially, let me just start and say, for kids, there's some observational analysis in kids that are able to do this healthy, but there's no universal guidelines, et cetera, for type 1. In fact, they're largely avoided by the institutional governing bodies at this point to make a stance on that, because of the lack of data that they feel comfortable utilizing to make recommendations. For pregnancy, there's virtually no data, although we know adverse outcomes with uncontrolled glucose levels. For older adults, they're treated like a general population unless they have some comorbidity or other disease state that they have to account for. And those are numerous and I guess impossible to address all here. Did that answer that question fully?
Yeah. So just to lead on to that question,
Yeah.
so then you're saying that we don't have enough research to support the uh, the relevance of low carb for different, like, teenagers or kids or pregnant women. But you've clearly stated that there have been a lot of studies showcasing the impact of good blood sugars, and you said that the first thing that, if you when you get diagnosed as type 1 diabetes, is to teach the patient or empower the patient that, hey, you need to, your food is critical, and insulin is critical, and to match the food to the insulin, and that whole balancing act. And well, I mean, I can tell you from my example,
Yeah.
when I was diagnosed, I was just told that, don't have milk, oh sorry, have milk in the night to avoid hypoglycemias, and then, like, cut out your fat, and then move on to better forms of carbohydrates, like move away from, say, processed flour into, say, oats and things like that. And I did it religiously for almost 10-12 years, only to end up with the complication. So my question is, Andrew, why are doctors not supporting low carb? Why are they not empowering the patients, or people who are coming? What is that barrier? Why are they not
Yeah.
telling us that, there is a way out, and you can have good blood sugars? And why did I have to wait for 15 years, or
Yeah.
even Nupur for that matter, to somehow fall into
Yeah.
low carb? I think we've all accidentally
Yeah.
fallen into it. But why? And
Yeah.
here are doctors or professionals like you, who are in the research field, who have the power to make a change and give
Yeah.
some hope that, like, I was told that, oh, you have brittle diabetes, sorry, your diet
Yeah.
sugars will never be under control. You sort of, that's how life is going to be. But
Yeah.
why this hesitation?
Yeah, and I want to even piggyback off a little bit of that because I didn't address this. We talked about this in pregnancy, but kids' blood sugar control, the data is overwhelming. The brain changes with adverse blood sugar control in kids. And in fact, 3 years post-diagnosis in kids with type 1 diabetes, their brain neuroanatomy changes. Their IQ starts to drop reliably. So, but this is just the norm. Like this is, and those are with just achieving standard outcomes. Like the expected outcomes in type 1 diabetes are accepted. And this is why I speak about this, because what if there was an option that could dramatically control the risk biomarkers for these adverse outcomes or make you feel better? Because right now we do have more than one study saying the quality of life is very high in patients who subjectively choose to self-select into an approach like this and sustain it. So, but to your point, yeah, this is why I'm here. I'm here to speak about this because, like, for example, in 2018, to give you guys a fully transparent insight here, there was a big opportunity at the school I was at and the whole community as a part of it. I think that was like over 100,000 people to apply to do a TEDx talk. And I applied to do it to speak about this topic. I got selected and long story short, I ended up doing it. But along the way, I was afraid to speak about it initially because I knew the ramifications potentially on my career for people to view Andrew Koutnik as, oh, that's Andrew Koutnik. That's low carb Andrew Koutnik. Like that's what he does. That's who he is. And I was definitely afraid for my career on how people would view me because I didn't want to be viewed that way. I don't want to be viewed as like Andrew Koutnik as a zealot for this low carb approach or anything along those lines. I'm here to just speak about what are options for patients. Like what is an option for a patient right now that they may want to opt into if they want to see some of the effects that other people who have used this approach have seen. It's not the patient's fault that there hasn't been sufficient funding allocated for research projects like this. We have to use the best information we have right now. The growing interest in this diet is overwhelming. That, in fact, even to today, even though the ketogenic diet trends if you search ketogenic diet on Google Trends, it's gone like this and it's starting to come down just a little bit because there's this huge interest about 2 years ago, like overwhelming public interest, which was huge. But we know it's starting to come down. But if you look up diabetes as a disorder in Google Trends, it's rising as the #1 rising topic for diabetes as a disorder. So patients are doing it. And often in type 1, they're doing it rogue. They're doing it without healthcare support because the healthcare, it has been cited that patients on this approach can often feel they're not supported by their healthcare professional, and they do it without their support. And that's just a bad recipe. But why is that happening? The reason that's happening is actually something you said before, Nandita. The reason that's happening is because doctors inform decisions based on studies that illustrate in a randomized control fashion of large populations that a approach is 1, paramount, safe. 2, may actually help improve outcomes in said population. Because if it's not safe, full stop, they're going to discourage it. But if it's safe, they may say, okay, choose if you want to. Here's what you have to consider. We have no trials like that in very low carbohydrate diets and type 1 diabetes. It's well past due that we have something like that that's funded because of the overwhelming amount of people who are doing it. But because of that, and because of the lack of information on this approach and the data that's currently out there right now, what is a clinician going to say? Hey, do that approach. Yes, I'm going to support an approach that increases the fat intake in a diet, or is sometimes termed ketogenic, although that's not usually the approach. People don't usually go onto this diet to become ketotic. If they're type 1, that's not at least what I've seen mostly, although some people may. What about ketoacidosis? Or if you eat less carbs, won't you go hypoglycemic more because you're eating less glucose in the diet? Or if my kid's not eating carbs and have high insulin levels, will they not grow as much? Or, the list goes on and on and on about the potential hesitations or hypothetical hesitations around this diet. What's important to say across almost all these, and this includes mental health in the introduction to this conversation, almost all of these adverse outcomes because we don't have hard outcomes right now. Some of them we do. We know quality of life has been subjectively reported more than once to be high in people who self-select and have good glycemic control in this diet. So that's number one. We know the incidence on average for those people who are doing that same thing, self-selected into this approach, the incidence of severe adverse outcomes, so actually going to the hospital or having an emergency-based event for hypoglycemia or hyperglycemia, is much lower in incidence than the historical average in type 1 diabetes. But what about the other ones? A hypoglycemic risk, pediatric growth. Like, these are all things that we don't have hard outcomes on for a clinician to give a stance on. But what do we do then? We have to look at the risk factors for those outcomes, because that's what we can guide decisions off of, because we pretty much know right now, based on the diet, where the data seems to suggest where those biomarkers are going. And a lot of those are hinged off HbA1c values. So higher HbA1c is usually associated with adverse outcome across the board for most of these hypothetical risks: DKA, low glucose coma-based events, pediatric growth, mental health status. There's a few others, but a lot of that comes down to high HbA1c values are often risk factors. Poor glycemic control is often risk factors, and complications are often risk factors. If you could improve HbA1c or improve your time in range or lower your standard deviation in your glycemic control, you're lowering the primary risk factors for those adverse outcomes. So based on the evidence we have right now, it seems to be a very, very viable option for people with type 1 diabetes. It doesn't mean we should ignore the potential for something to not be going well or not go right. That's obviously very, very important. Safety is the most important thing when doing an approach like this. But we can't ignore the standard outcomes in type 1 diabetes either. The standard outcomes in type 1 diabetes increase patients with my disease for all 10 leading causes of death. You're expected to live 11 to 18 years shorter. Kids who are diagnosed within 3 years have changes in their brain and cognitive function, which reliably sustains. Kids with type 1 diabetes have an altered growth curve, which it seems to be, all this seems to be associated with poor glycemic control. If you could dramatically improve glycemic control and improve risk biomarkers, and you're able to do it safely, sustain quality of life, mitigate the adverse outcomes by doing it the right way, why not? And that's what I'm here to speak about, because I've looked at every single one of these trials. I've looked across the ranges of how the biomarkers are shifted across all these diets. In fact, we're in the process of trying to look at every study ever done for macronutrient content and these outcomes. And hopefully we'll be able to get that out and published soon on this topic. But all to say, the evidence right now seems to suggest that you have to consider all factors in the disease management, and not just the hypothetical risk, which right now the data on very low carbohydrate diets and type 1 diabetes does not support the idea that you're going to have greater adverse outcomes. In fact, the exact opposite. So that must be appreciated. Obviously, if new evidence comes out and disagrees with that, we have to change our mind. We have to change how we view these things. But patients are doing it. The data we do have is what we have to rely on right now. And right now that looks really good. And if we don't have data, we have to extrapolate based on what we can at this point. You can't just say nothing. If a patient shows up to your clinic and says, I'm going to do this approach, you just go silent. You have to do something. You have to be informed. And I think that's where greater education is critical. And that's honestly why I'm speaking with you guys here today. I think it's important to speak more about it and to inform for those who are interested.
Yeah. Absolutely. I mean, these are really, really exciting, powerful points, that Nandita and Andrew just spoke. I'm going to do a quick, very short gist in Hindi. I think everyone deserves to know this. It's really, really important. Like Nandita said, बहुत सालों तक हमें पता नहीं था कि लो कार्ब भी एक ऑप्शन है. पिछले कुछ सालों में हम लोग लो कार्ब करना शुरू किया है. तो वेरी शॉर्ट में मैं बताऊंगी अभी आपको कि क्या बच्चे लो कार्ब कर सकते हैं, छोटे बच्चे, क्या प्रेग्नेंट वुमेन लो कार्ब कर सकती हैं जिनको डायबिटीज है, और क्या बुजुर्ग लोग जो एल्डरली पॉपुलेशन है, क्या वो लो कार्ब कर सकते हैं. बच्चों के केस में कुछ साल पहले एक हार्वर्ड की स्टडी थी जिसमें वेरी क्लियरली मेंशन्ड है, और ये साइंटिफिक स्टडी है, आप इसको नेट पे सर्च कर सकते हैं. इसमें मेंशन्ड है क्लियरली कि जो लो कार्ब करते हैं उनके आउटकम्स काफ़ी बेटर हैं, उनका कंट्रोल बहुत ही एक्सीलेंट है. रिगार्डिंग प्रेग्नेंट वुमेन, आई थिंक जब किसी को जेस्टेशनल डायबिटीज होता है तब उसे बोला जाता है कि आपको कार्बोहाइड्रेट थोड़ा सा कम करना है खाने में, और आपको शुगर कंट्रोल रखना है। तो डेफिनेटली मतलब स्टडीज नहीं है और फंडिंग की काफी जरूरत है ये एरियाज में। तो दिस इज समथिंग दैट पॉलिसी मेकर्स और डॉक्टर्स और रिसर्चर्स को साथ में मिलकर के करना पड़ेगा। लास्ट पॉइंट अबाउट द एल्डरली पॉपुलेशन, जो बुजुर्ग लोग हैं उनके लिए भी डेफिनेटली सेफ है, अनलेस उन्हें कोई दूसरे हेल्थ कॉम्प्लिकेशंस है जो कुछ केसेस में हो सकते हैं। तो बट ब्रॉडली स्पीकिंग लो कार्ब एब्सोल्युटली सेफ एंड हेल्दी है। इनफैक्ट अगर आपकी शुगर हमेशा हाई रहती है, अगर आपका HbA1c हाई रहता है, अगर आपको कुछ कॉम्प्लिकेशंस है, तो ये सारे रिस्क फैक्टर्स है और इनके कारण आपका क्वालिटी ऑफ लाइफ और आपके नंबर ऑफ इयर्स लाइफ के भी कम हो सकते हैं। तो ऑब्वियस और लॉजिकल चॉइस जो है वो है कि मैं अपने शुगर्स अच्छी से कंट्रोल करूं और मुझे चॉइस मिलना चाहिए लो कार्ब का। तो वो जिस्ट है ये टॉपिक का। I see Isha's comment. Isha is a T1D from Canada, and she says, she does low carb, and she says that my doctor keeps pushing me and saying that you'll develop an eating disorder. How do I sort of, convince them that low carb is not a temporary option for me?
So specific to eating disorders, this is a big topic, especially for parents. It is at higher risk for those with type 1 diabetes who are also female. At least it says that in the literature. So so when you get type 1 diabetes, as we talked about before, you have to eat something, right? So and we know that what you eat affects your outcome. So we also know the literature says that more restrictive eating can lead to eating disorders. So how do you manage that? Because you know that your food is going to affect your disease outcomes. We know that being very conscious of what you're consuming, but also going on a diet that may be restrictive, are risk factors for eating disorders. It comes down to the individual, right? So if the individual is going on an approach because they find it to be sustainable, enjoyable, improve their health outcomes, that is important for that individual on their approach. You're not guaranteed to develop anything with type 1 diabetes. For the record, everyone may say you're going to get complications with type 1 diabetes. They don't guarantee. The data right now says that your risk is higher. You're not guaranteed anything. We talked about mental health and still talking about this. The risk is way higher. You're not guaranteed that you're going to have these adverse outcomes. Your risk is higher, and most people with my disease are hoping to not have those adverse outcomes. So you're mitigating risk. But when it comes to things like eating disorders, we don't have good data on it. I can tell you that right now. We know that there are risk factors that clinicians would be concerned about, but I think it's also important to acknowledge that you have a disease now where food is incredibly important on your disease outcomes. You can't avoid having to think about it. You can't avoid having to manage it. So what approach do you choose? Because you have to choose something, and you can't, if you just say, well, eat whatever you want and, whatever. Well, we know that people who are eating whatever they want, the average outcome in type 1 diabetes, even with those who are, they're not just told to eat whatever. You're immediately told you should be carbohydrate counting. You're immediately told you have to calculate all the carbohydrates. You have to then inject insulin. You're immediately told to eat healthier food options. You're immediately told to change your diet and to go on a dietary regimen. What's different if someone were to say, hey, you're actually do this approach or predominantly try to switch to an approach over here? They're all telling you to change your diet. They're all telling you to improve your dietary outcomes. And again, this is the point of when we were talking about before about restriction and not feeling deprived. It's all relative. I don't feel deprived every single day. And I know that if I were to eat foods that dramatically increase my blood sugar through the roof and are hard to manage with the current insulins we have available to us, I don't feel good. It's an immediate response. I'm going to feel terrible sometimes for the rest of the day if I have a huge up and down, or if I go low. And so it's a balancing act. What do you choose? And I'm speaking about this as a patient right now. What do you choose? Do you just eat whatever you want and reliably that doesn't work well across the type 1 diabetes population? Or do you choose something that helps you on your disease management path, because you got to do something. If you want better outcomes, you have to be conscious of them and work towards doing something about it. And then you have an array of choices on what you do to manage that. And obviously, we're talking about a little more focused on low carbohydrate discussions here. And that's an option. And arguably, I would say at this point, there's this might be a bit controversial, but I see very limited situations where someone should be ever discouraged to have this on the plate of options when they arrive into a doctor's office and they're diagnosed with type 1 diabetes, or they already have diagnosed, and any reason why they should say you shouldn't do this. I think they should be walking in the office and say, hey, by the way, here are some options you should consider, and this should be on the table for that patient. I don't think you should be taking away options when there isn't data to say you should be taking it away right now. If anything, it's saying this should be an option, if not one, presented predominantly as something to consider, along with what is the expected outcomes on this. And again, probably not happening anytime soon until we have these long-term randomized controlled trials. But it doesn't mean people can get out and speak about it and provide education and bring awareness for patients who are living with this disease. And for the record, I've had type 1 diabetes for 16 years. Nandita, you've had it for longer than me, almost a decade longer than me. For the first 10 years, I knew of 0 type 1 diabetics doing this approach. But I knew it completely changed my life. And I didn't speak to anyone else about it because I thought, oh, this is my approach. Actually, that's not true. I did speak to some people about it. I was invited to a few med schools to speak to them because of the outcomes I had. So they were like, well, what are you doing? Let's look into this a little bit more. But there's been published literature on very low carbohydrate diet going on like 3 decades now, showing that there's an ability to see some really good biomarker outcomes. So I guess I'll pause there and just say, I'm here to speak about this because I think it's important to discuss it, but I don't want to, you can't avoid these conversations about, you're not guaranteed any adverse outcome. And I think it's important to appreciate that you have to choose something, and managing your disease, being completely lax on the approach leads to the average, if not worse, outcomes in type 1 diabetes. And those, in my opinion, are unacceptable. So.
Okay, great. Rohan has a question, Andrew. He says, I have a question on exercise and low carb. I used to take a high carb snack before exercising, and now I feel dizzy or lack of energy sometimes when exercising. So, what tips would you recommend for exercise and being on low carb?
So I find reliably like the one thing that throws a wrench into everything, which I exercise every single day. So at least I try to, and sometimes more than one time a day. I believe that the benefits of exercise almost always, if not always, outweighs the risk. And that's certainly the case in the general population, the aging population, even people with cardiovascular disease. You just have to do some upfront risk mitigation. But either way, exercise is overwhelmingly beneficial for overall health. So and I love it. It makes me feel better. That also goes into mental health. It's one of the most reliable ways to improve your mental health acutely and chronically if you sustain it. But what are the tips? So it all comes down to consistency. We know that exercise at certain times of the day and type of exercise affects blood sugar totally differently. Okay. So aerobic exercise, if it's prolonged, can lead to a blood sugar drop later. If you do aerobic exercise or resistance exercise, it doesn't always reliably elevate your blood sugar levels. But if it's intense enough, it can. So it's a spectrum from like aerobic exercise seems to potentially drop it to resistance exercise. If more intense may elevate it. But these all right here is just if you control absolutely everything, but that's not the type 1 diabetes life or a person with type 1 diabetes, how they live. You're considering, are you working out in the morning because you have to do it before your kids wake up? Are you doing it in the evening because it has to be after work? You have to do when and whenever you can do it. So that may mean that if this is not probably the answer he was looking for, but you have to test it on yourself. You have to find out how you respond as an individual. And let's say that every time you exercise a certain way, let's say it's aerobic exercise, you get on a cycle bike for 30 minutes. Let's say 30 minutes into that, I'm always dropping. Okay, well, then you probably do need to take some carbohydrates either right before that happens to mitigate it, or change some other factor that leads to you dropping mid-exercise. If it elevates every single time you exercise, then maybe you need to be proactive and mitigate that if you feel comfortable doing that with insulin. But anytime you take insulin prior to exercise, it gets a little hairy because it could drop. Reliably exercise increases the absorption of insulin and then circulation of insulin. So you have two factors that are dependent on the intensity of exercise, the duration. But foundationally or fundamentally, it's individualized because there's so many factors that affect glycemic control. What I do personally may or may not work for him. And so I find that when I've gone on a low carbohydrate based approach, it is much easier to exercise while fasted. I very rarely, which I find to be just so easy for me. It wasn't before. That was like a no-go. Like I can't exercise without eating. But now it's very, very easy. I find it actually to be more reliable when I feel better. But that said, it comes down to consistency. Consistency is king in type 1 diabetes. If you can have a consistent lifestyle and you stick with it, you can find how your body tends to respond. And then you can make micro adjustments to improve how you want around that consistency. Without consistency, it's going to be very, very hard to elucidate what factor in your life is contributing to you not having the blood sugar control you want during exercise in order to change it. So what I would instead say is try to build some consistency in your life if you can, and then modify some of the key factors you know are contributing to you not feeling or having the ideal blood sugar outcomes. Because ideally, data pretty much says, data right now says that normal blood sugar is ideal during exercise for performance and feeling good. But usually the recommendations in type 1 diabetes say go hyperglycemia because you want to reduce the risk that you may come crashing down because of exercise. But if you can achieve normal glucose levels through exercise, I think no one's going to argue against that's a good idea unless they think it's going to lead you to hypoglycemia. But if you're not going hypoglycemia throughout exercise, then why not have normal blood sugars? So that's the argument right now. Maybe the data will change. There is some interesting data that individuals doing extremely high intense exercise, not in type 1 diabetes, but in elite level athletes, may be slightly hyper during certain parts of the exercise when it's extremely, extremely intense. The argument for if that's good or not is a totally different discussion. But to say consistency is king, find what works for you, and then modify to better optimize your outcome. But appreciate that the factors that go into that: type of exercise, timing in the day of exercise, the duration of exercise, and all the other factors that normally affect your blood sugar. Those are key factors here also. They come in. So there's a lot to consider, obviously, in type 1.
Thanks, Andrew. I know what you're saying is so important, and I just want to remind our audience that the recording of this video will be available on our Facebook page, Blue Circle Diabetes Foundation, also on our YouTube channel. So by end of day, you'll see it at both places. I recognize we're running over time, and we have so much to talk, and I see a lot of comments. So I think maybe we could pick up the last two questions. I'll go with Nishtha's question here. She says that I've started moving towards low carb now, but I fear low carb because I feel like a couple of cheat days will throw my BG out of whack. Is this true? And can I have cheat days without much of disruption?
Well, okay. So the idea of having a strict diet and then having cheat days, the idea of a cheat day in general is because, well, I'm doing something that's so difficult that I can't reliably do it forever. So I want to cheat on it. I would encourage any individual who's doing any dietary approach to do it in a way that's sustainable. Find why it's not sustainable for you. Is it because you're not having like certain types of sugary, starchy carbohydrates that you enjoyed? Well, then try to find low carb alternatives for that you can have in your diet that reliably allow you to get ideal glycemic control. From a blood glucose perspective, you can't cheat carbohydrates and sugar. If there is sugar in that food, it's going to affect your blood sugar, period. You can't, type 1 diabetes can't hide from sugar in the diet. Like it's not a thing. So if you have days like that, where you feel like you need to have higher carbohydrate options, it's going to affect your blood sugar like a high carbohydrate based food will. There's no getting around that. So arguably I don't do that because I find that when I don't feel good, when I go off, I also find I don't feel good for the rest of the day when I get outside of normal control. And I only really appreciated that once I actually had good glucose control. I realized I don't think I assume this probably translates to others, that when you're running high all the time, what it actually feels like to be normal. And when you feel normal and you start going outside of that, that's usually an incentive to not go off. But I would encourage sustainability in any approach you do, and try to build in factors that find out why it's not sustainable and you want a cheat day. Let's say if you want to do this approach and you want to make a sustainable lifestyle, find why you're looking for a cheat meal. Do you feel deprived? And then if you do, why? Because if you can look at the why for that, you might be able to address it, because there's a lot of people who find sustainability in this approach, reliably, in fact, thousands at this point. We know that in community groups, social media community groups. So find out that why and work with that. But at the end of the day, if you're going to have a cheat day and that cheat day encompasses more carbohydrates, it's going to affect your blood sugar like a carbohydrate always will, and always has. So just keep that in mind if you were to do that.
Okay. I think there are some more questions coming in on exercise and low carb. Prashant Vivedi says, I take 2 dates before exercising with black coffee and I don't feel dizzy. But yes, when I tried exercising without eating anything, I could not focus and I couldn't do anything. So, what is the ideal? What should we what should we do before exercise, especially when it comes to a low carb diet? How, like, if you're exercising in the morning, what do we do? Or if some people are exercising in the evening, what are some tips, practical tips, Andrew, that you would
Yeah.
recommend?
This is going to be a tough one to answer again, because the individualization on this is so important. So my ability, for example, I said I fasted exercise is what I sometimes do that. Not always. If I do resistance exercise, I choose to have something beforehand. But what most people do, let me say that. I won't say necessarily what I do or what I necessarily recommend, but let me say what most people do with greatest levels of success. What those people are doing is they are having generally around 4 meals a day: breakfast, another meal, let's say 4-ish hours later, another meal 4-ish hour later, and then a dinner-based meal. Or if you do 3 meals, that's the individual's choice. But placing them around exercise, if you feel like you need to have a meal before exercise or you don't feel well, it did take me a period of time to feel better exercising fasted. It wasn't like, oh, I just went and fasted one day and I felt great. It's like it took time to get to that point. And I'm sure my body went through some adaptations to get to that stage. But for that individual, if you feel better exercising on food, then generally what I find most people have reported great success in what they do with low carbohydrate options is they have the low carbohydrate option 1 or 3 hours later. And they do so with the things like regular insulin, or some people do a dual way bolus if they are on a pump with rapid acting insulin. And they account for the fact that they know they're going to exercise in that. And what I have found is these slower acting insulins and lower insulin on board dramatically reduces the incidence for huge swings, because the one big factor during exercise that people have to consider with type 1 diabetes is it changes the absorption, the uptake, or the binding, or the absorption, the circulation of insulin a lot. Okay, it can also change the sensitivity of insulin. So, and it all leads to having more rapid blood sugar drops. So if you say you had 6 insulins, IUs of insulin before exercise, and your insulin sensitivity dropped to half that, well, now you have twice as much insulin on board than you needed. What if you were taking 6 units of insulin? Now that may act like 12 units of insulin if you were rested. But if you were taking, let's say, 1 unit of insulin pre-exercise, now it's acting like 2. That's a 6-fold difference, right? And so less insulin on board may help reduce the incidence for things getting too far out of whack or uncontrollable, to where you're like, downing Gatorades or orange juice drinks or whatever, sugary-based drinks someone does to mitigate that. The lower the absolute amount of insulin pre-exercise, the better, the more likely the less likely you are to have an adverse event happen, because you might not exercise the same way every day. Most people don't go to the gym and say, I'm doing the same thing every single day for the rest of my life. They may say, I'm going to do something different today. I'm going to have some fun. I'm going to try this. I'm going to try that. And their efforts to do that, it's going to change how they respond to that potentially. So they have to account for that, and just generally lowering the amount of load of things in the system that are going to cause more dramatic ups and downs may help mitigate that. But obviously having sufficient food may help. And on low carb, people tend to have protein-based food options far enough out to where they're not feeling it in their stomach pre-exercise, which might mean also lowering the fat content in that food pre-exercise. I don't know if that's helpful, but it's really hard to say this is what you should do every single time, because everyone's different. I used to eat before every single workout. I used to eat 4 meals every single day. I now have 2 kids. My lifestyle is all over the place. Sometimes I exercise in the morning, sometimes I exercise in the evening. And so what I have to do is I wake up and I just I just deal with the day as it comes. So if I know like for today, I woke up at 5:30 and I knew we were going to be doing this. I know that I need to go to the grocery store with my family. I know I need to exercise some point today. I know I have a project I have to work on. So how do I optimize my life? Okay, well, I'm probably going to go to the gym faster today after I get 2 or 3 of those things done around my family's schedule. And it's just going to be easier for me to fast. So I'm just that's what I'll just do, because I can usually ride out the fast until I'm done exercising. Then I'll have my meal, et cetera, et cetera. If I have to structure everything around food, et cetera, then it makes it a little less flexible. So I've adapted my life in a way that works for me and my family's needs, my personal diabetes needs, and that's what works for me. But most people, it's going to be different because their lifestyle is going to be different. Their needs are different. Their expectations are different in life. And so, they have to work with those.
Yep. I agree. I also feel that fasting, exercising fasted works for me as well. There was this fear earlier when I was in high carb that I need to stuff myself with food and exercise and not go low. But I think exercising fasted works brilliantly for me as well. And I couldn't agree more. Consistency is king. You just have to keep doing the same thing over and over again. To be able to see what works and what doesn't work, and then tweak around a bunch of things. So we're way over time, and the questions keep coming in. Maybe Andrew, we should plan a part 2.
Yeah.
On this Facebook Live with you,
Yeah.
because I know we still have a bunch of questions left from what Nandita sort of came up with the questions. So what we're going to do now is we're going to wrap up the session today. A big thank you to Andrew, Nandita. This has been an amazing discussion. Prashant has put in a link to Andrew's TED Talk in the comments section. So for those who'd like to watch it, please, you'll find the comment in the comment box. Go check it out, and we'll whenever Andrew's free, we'll plan another session, and keep those questions coming. I think this is amazing. I'm loving the response to and the interest with regards to low carb. I think it's really heartening to see, and I know Nandita and me, we've been doing it for a few years, but people still have those questions and those inhibitions. So I think a lot of that has been addressed today. So thank you so much, Andrew, for doing this with us.
It was an absolute pleasure. I appreciate what you guys are doing in Blue Circle Diabetes Foundation. As we've spoke about before, when we first got introduced, and I was like, "Hey, what are you guys doing? This looks really, really cool and interesting." And when I found out what you guys are doing and the scope of the impact that you guys have the opportunity and have had already, I am honored to be here. I would absolutely come back and answer as many of the other questions that have arisen for sure. No, this is for me as a person with type 1 diabetes, also having directly researched lifestyle impacts of disease and health outcomes and also performance. I feel the most important thing I can do is help provide evidence-based information and then also education where it's appropriate. And I appreciate the opportunity to be here to speak to everyone. I hope it was helpful for every individual. And I also, if people reach out, so I try to keep myself somewhat regular on Twitter to provide information and education. For a while there, I was a little bit hesitant to do that. Social media has its pros and cons. But this is how we met. We met through social media. So there's a lot of positive, and I try to keep it all positive and educational. So if anyone has any comments, questions, et cetera, and they reach out via that platform as well, I might be able to get to that. But I'd love to get back on and kind of try to do that all in one big opportunity. So appreciate you guys, and thank you guys for what you guys are doing for those people living with type 1 diabetes to help improve the quality of life of people with our disease. So appreciate you guys.
Thank you. Thanks once again, everyone. Have a wonderful rest of the day. Thanks, Andrew, Nandita. We'll see you guys soon. Thanks, everyone, for tuning in. Bye.
Thank you. Thank you, Andrew. Thank you, Nupur. Bye-bye.